FYZICAL Physical Therapy and Balance Centers.
Okay. Hi, this is Dr. Mitchell Hackerman with Physical Therapy and Balance Centers. FYZICAL, spelled different because we are different. I see a lot of back pain patients. I'm one of the few credentialed McKenzie practitioners in the area. I think actually I'm the only one. I'm here to give you a little bit of a tip. If you can use this, I hope it works out for you. A lot of people have neck and back pain, and one of the common features of a lot of people who have neck and back pain is problems waking up in the morning with pain, or they're waking up during the night while they're sleeping. And the reason is because gravity has an effect on pain and on your back pain. If you see me stretch my finger here, when you look at me stretch my finger, that is strain. If I push any harder, it's going to be pain. Now imagine me holding my finger like this all evening. That could be a real problem after a while. So imagine holding a sustained pressure on an injured body part like your neck or your back. Your neck and your back are composed of discs. Discs can be looked at almost like jelly donuts. They have fluid inside them like a jelly donut. If you push on one side of the donut, where's the fluid going to go? It goes backwards. So if there's any defects in the disc or any problems, you can have a problem. There is no nerve or blood supply within the confines of a disc. A lot of people don't know that they have a back problem until it reaches the backs of the disc. It creates pressure on the back of the disc, causing pain. Now when you're sleeping at night, notice here that we have a rib cage and we have pelvis. That's bony protection. But there is no bony protection right over here. This is all soft tissue. So when you sleep, you're going to put pressure on that low back while you're sleeping, and you're going to have a problem. So we need to do something to dissipate that force and keep your spine in a neutral position where it's not going to be overly stressed. So how do we do that? So here I took a couple of basic towels. I have this extra towel here because I've determined that I need it for the thickness that I want and that I need. Okay? I'm going to put the towel, you can use a shoelace or you can use a bathrobe belt. And you just roll it up like this, nice and tight. Take the rubber bands on each side. You can use more than 2 rubber bands. Actually, I suggest you rubber band it all the way along the length of the roll to secure it better. But I've got 2 here and that's what I'm using. The thickness is such that it should compress to about 1.5 inches, emulating your body weight. If it's less than 1.5 inches, it's usually too thin. If it's more than 1.5 inches, it's usually too thick. But you will determine what works for you. You might determine that, you know what, I need it a little more thick, so you may add some more layers of towel. If it's too thick, you may want to get rid of this layer, or you may have to roll it up to a degree and allow some fringe to just flop off the edge. And then you wrap it around your neck. You will get used to this. It's very awkward to sleep with it first, but just like a kid gets used to wearing a retainer and can't even speak, they get used to it. If this helps you with your pain, you'll get used to it. Now you can see no matter what position I get into, when I sleep, my neck will be blocked from reaching an end range position, and my neck will be able to heal properly because it will be left off of stress. The same goes with your back when you make a longer one for your back, where you have to use beach towels. Okay, thanks. Hope you got something out of this. Feel free to give us a call anytime with any questions. 884-9800, CapeMayPhysicalTherapy.com. Have a great day.
FYZICAL Physical Therapy and Balance Centers.